Are you feeling like a data analyst instead of a medical affairs professional? Well, here's probably why. There's typically 3 reasons why I see this happen today. Number 1, you're stuck in spreadsheets doing manual analysis of field insights or med info inquiries. 2, you're oftentimes missing or having to spend time to gather context behind different metrics that you see, especially if you have existing dashboards in place. So whether you use Power BI, or perhaps you're using a vendor already that displays some sort of charts and graphs around your insights. And then lastly, the process of generating reports, emails, or really synthesizing all of this analysis into a document itself is very time consuming to ultimately end up in just a static document that gets shared, whether that's internally or cross-functionally, which can oftentimes, depending on who's looking at it, miss some of the critical context that could be useful for that particular function. So let's dig into these 3 and talk through how you can actually go about addressing it so you can spend all of that time rather than being in the weeds of spreadsheets and analysis, actually leveraging that time to make strategic and proactive decisions around your medical strategy or your field efforts or your medcoms, med info, etc. So number 1, if this sounds familiar to you, where on a weekly, monthly, or quarterly basis, you might pull your raw field insights from an existing vendor tool or CRM, and then you're going through in the spreadsheet and labeling it, categorizing the therapeutic areas, the type of insight, the sentiment, etc. So if you see this, 1, you're not alone. I see this often across a variety of teams. And while some vendor solutions might do the basics, like allow you to create tags, or they will analyze sentiment, or maybe they'll do basic tagging, oftentimes it's just not enough to get you the richness of insights that you are looking for. So in this case, what we often see that can help is really leveraging generative AI. Part of the value of generative AI is that because it was trained on language, it unlocks a new ability to be able to analyze unstructured data, which field notes, med info inquiries oftentimes are. So you could always experiment with ChatGPT, or you can consider using vendor solutions like Atrix or others who leverage that technology to help you take those notes and automate that process in a way that's personalized specifically to your team. So number 2, oftentimes what we see with medical affairs teams is that they have Power BI dashboards, or maybe the vendors that they're using have dashboards that show activity metrics, right? Number of MSL notes, number of MSL notes around a drug called parallax, etc. That's great, and we definitely need to have basic metrics, but oftentimes what's missing behind those metrics is the context. So for example, if I saw that there was an increase in calls around cardiovascular comorbidities for a drug called parallax, the first question I'm going to have is why? What drove that? That context is important to know, so that way you as a team can know how to actually act on it. Just knowing that there was an increase in the number of calls on this topic is not in and of itself that insightful. This process then ultimately becomes manual because now you have to dig through all of those notes or those calls to try to synthesize patterns around what is ultimately causing that increase. So this is where a technology like AI, in combination with a subset of generative AI, can really come in and detect any sort of trends or anomalies that are occurring in the data, while also simultaneously picking up on patterns that might be behind this trend. So vendors like Atrix and perhaps others on the market could offer that. This is something that I would say is hard to automate by just using a ChatGPT prompt. This is something where you will need a technology to help automate that process. But wouldn't it be wonderful if you just were able to get a report on a daily or weekly basis that was like, hey, you had an increase in calls. Here's why. It's coming from this geo, from this type of practitioner. The pattern is around cardiovascular comorbidities. This is the type of communication patterns that have been had with these HCPs. Now you have all of this context, and then you as a medical affairs professional can really interpret that to determine what the next best step is, whether that is deploying MSLs, whether that's creating a new piece of content, etc. So number 3, generating reports. So generating reports, which typically end up either in an email, a PowerPoint, or maybe some sort of narrative type of summary, can also itself be fairly time-consuming. While tools like ChatGPT can help you synthesize and kind of get a first rough draft, oftentimes there's still a lot of work that you have to do on top of that. The reason why reporting is really important is because an insight that is not communicated can't make an impact. And oftentimes, insights that come from medical affairs can impact not only internal medical affairs teams, but also cross-functionally, anyone from market access to commercial, etc., to clinical dev. All of those functions have very different lenses. So if you're sharing one piece of content, it's not personalized to each of these individual functions. And that is the challenge of a static report. But what if instead, sure, you could generate a static report, or you had an easy way where folks can effectively ask the data the questions that they want to generate the insights that they are looking for from their particular lens from that data. Well, the new capabilities of what a technology like generative AI can offer is the ability to interact with that data in a question and answer type of way. So you could almost imagine if you had a tool that allowed, whether it's market access or clinical development, to be able to tap into the insights that you have from medical affairs in a natural language way, then that is a very personalized experience to them. And it almost is like a living dynamic report in a way that they can access at any point in time. So to address that, it's really about shifting the perspective of, static reports have their place, and there's certainly ways to automate it through tooling. You can create reports via charts and dashboards and leverage ChatGPT to create narratives, or you could also enable a way for teams to interact with that data in a natural language way. So these are the top 3 ways I see folks across medical affairs get stuck in time-consuming data analysis type of tasks, instead of focusing on more strategic decision-making when it comes to medical strategy, and also some ways of addressing it. If you have any sort of questions around this, don't hesitate to DM me on LinkedIn, and then follow us on YouTube for more content around tech, AI, and pharma and life sciences. Thank you.